Welcome to the J-MAKINS Sentinel Foundation. We are a non-governmental organization advocating reproductive health, fertility, and IVF awareness, safe childbirth, and family planning. We empower single mothers and protect vulnerable women and children. Through our Family Academy, we provide education, training, and support systems to build stronger families. Starting your in vitro fertilization, or IVF, journey is a big step. This essay is here to guide you. We will walk through the process together, one step at a time. It is for anyone who wants to understand what really happens during an IVF cycle. We will use simple words and short sentences. The goal is to make this complex process feel clearer and less scary. Feeling nervous or overwhelmed is completely normal. Knowledge can be a powerful tool for calm. This guide will explain what the clinic does and what you will do. You are not alone on this path, and many people have walked it before you. Your first visit to the fertility clinic is a consultation. This is a chance for you to meet the team. You will talk to a doctor, a nurse, and maybe a financial counselor. They want to learn about you and your health history. You will discuss why you are seeking IVF. They will ask many questions. It is also your time to ask questions. Write down your questions before you go so you do not forget. Ask about success rates, ask about the process, ask about the costs. No question is too small or silly. This meeting is about building a partnership for your care. During this first visit, the clinic will plan some initial tests. These tests help the doctor understand your specific situation. For the person who will carry the pregnancy, tests often include blood work. This blood work checks hormone levels, like AMH, FSH, which tell us about your egg supply. An ultrasound of the ovaries is also very common. For the person providing sperm, a semen analysis is standard. This test checks the number, movement, and shape of the sperm. These tests give the doctor a clear picture of your fertility health. They are the foundation for your personalized treatment plan. After the tests, you will have a follow-up meeting. Here, the doctor will review all the results with you. They will explain what the results mean. Then, they will propose a specific IVF plan just for you. This is called a protocol. It will outline the types of medications you will need and the timeline for your cycle. You might also discuss potential risks, like ovarian hyperstimulation syndrome, or OHSS, which is rare but important to know about. This is also when you will get a clearer idea of the costs involved. IVF can be expensive, so understanding the financial part is crucial for planning and reducing stress later on. Once your treatment plan is set, the preparation phase begins. This stage is about getting your body ready for the IVF cycle. Sometimes the doctor will prescribe birth control pills for a few weeks. This may seem strange when you are trying to get pregnant. However, the pills help to regulate your menstrual cycle. They calm the ovaries before stimulation begins. This gives the doctor better control over the timing of your cycle. It ensures that your follicles, the small sacs in the ovaries that hold the eggs, start growing at the same time. This part of the process is about creating the best possible starting point for your treatment. This is also a time to focus on your overall well-being. The clinic will advise you to live a healthy lifestyle. This often includes eating a balanced diet, avoiding smoking, avoiding alcohol, avoiding too much caffeine. Walking, yoga, it can reduce stress and improve blood flow. Your doctor may also recommend you start taking prenatal vitamins. These vitamins contain folic acid, which is important for a healthy pregnancy. Taking care of your physical health is a way to actively participate in your treatment. It helps you feel more in control during a process where many things are out of your hands. Mental and emotional preparation are just as important as physical preparation. The IVF journey can be an emotional roller coaster. Hopeful one day, anxious the next. This is a good time to build your support system. Talk to your partner, a trusted friend, or a family member about your feelings. Many clinics have counselors who specialize in fertility. They can provide coping strategies and a safe space to talk. Deep breathing, meditation, journaling. Taking care of your mind is not a luxury. It is a necessary part of this journey. Before you start the medications for stimulation, you will have a baseline appointment. This usually happens on the second or third day of your period. Blood test, transvaginal ultrasound. The blood test checks your hormone levels to make sure they are low. The ultrasound checks your ovaries to ensure there are no large cysts. It also confirms that your uterine lining is thin. This appointment is like a final green light. It confirms that your body is ready to begin the next phase of treatment. Ovarian stimulation. It is the official start of the active part of your IVF cycle. The ovarian stimulation phase is when you begin taking medications. The goal is to encourage your ovaries to produce multiple mature eggs. Usually your body releases only one egg each month. For IVF, we want more eggs to increase the chance of success. You will give yourself injections of hormones called gonadotropins, hormones like FSH, LH. A nurse will teach you, maybe your partner too, how to do the injections. They are given with a very small needle, just under the skin of your belly, thigh. It can feel daunting at first, but most people find they get used to it quickly. This part of the cycle typically lasts for about 8 to 14 days. During this time, you will visit the clinic frequently for monitoring, usually every 2 or 3 days. At each visit, you will have a blood test to check your hormone levels, especially your estrogen level. You will also have a transvaginal ultrasound. The ultrasound allows the doctor to see the follicles in your ovaries, measure the size, count the number of growing follicles. This monitoring is very important. It helps the doctor adjust your medication dose to ensure the follicles grow at a good rate without overstimulating the ovaries. As the follicles grow, you might start to feel bloated, feel full in your lower abdomen. Your ovaries are getting larger than usual, so this is expected. You might also feel more tired, more emotional than usual. This is due to the high levels of hormones in your body. It is important to be gentle with yourself during this time. Avoid high-impact exercise, as your ovaries are enlarged and delicate. Listen to your body and rest when you need to. Remember that these feelings are temporary. They are a sign that the medication is working and your body is responding. When the ultrasound and blood tests show that your follicles have reached the right size, it is time for the final injection. This is called the trigger shot. This shot contains a hormone called HCG, GnRH agonist. It helps the eggs go through their final stage of maturation. It also prepares them for release from the follicles. The timing of this shot is extremely important. You will be given a precise time to administer it, usually 36 hours before your scheduled egg retrieval. Following this instruction exactly is critical for the success of the retrieval. After this shot, the stimulation phase is complete. The egg retrieval is a minor surgical procedure. It happens at the clinic about 36 hours after your trigger shot. You will be asked not to eat or drink for several hours before the procedure. You will be given light anesthesia or sedation through an IV. The procedure itself is relatively short, usually taking only about 20 to 30 minutes. It is a significant milestone in your IVF journey. It is normal to feel both nervous and excited on this day. The doctor performs the retrieval using a transvaginal ultrasound. A thin needle is attached to the ultrasound probe. The doctor guides the needle through the vaginal wall into each mature follicle. Gentle suction draws out the fluid from each follicle. This fluid contains the egg. The doctor drains every accessible follicle on both ovaries. The fluid is collected in test tubes and passed to the embryologist. The embryologist is the scientist who cares for your eggs and embryos. The whole team works together to keep the process smooth and quick. After the procedure, you will rest in a recovery area for an hour or two. Nursing staff will monitor you as the sedation wears off. It is common to feel some cramping, similar to period cramps. You might also have some light spotting. Most people feel well enough to go home the same day, but you will need someone to drive you. The clinic will advise you to take it easy for the rest of the day. Rest. Drink fluids. Use a heating pad for any discomfort. While you recover, the embryologist examines the fluid under a microscope to find and count mature eggs. On the same day, the sperm sample is prepared and the healthiest sperm selected. Then, fertilization happens. This can be done in two ways. In conventional IVF, the eggs and sperm are placed together in a dish to fertilize on their own. In ICSI, intracytoplasmic sperm injection, a single sperm is injected directly into each mature egg. The doctor decides which method is best, especially based on sperm quality. After fertilization, the next phase begins in the laboratory. This is called embryo culture. The fertilized eggs are now called embryos. They are placed in a dish with nutrient-rich liquid. The dish is kept in an incubator. The incubator is a highly controlled environment. It mimics conditions inside a woman's body. Temperature is carefully controlled. Oxygen levels are carefully managed. Humidity is carefully managed. The embryologist checks the embryos daily. They watch to see if the cells are dividing and growing as expected. This is a delicate and crucial period of development. The embryos grow for several days in the lab. The embryologist grades them by appearance and development. Day 3. A healthy embryo has about 6 to 8 cells. By day 5, it should develop into a blastocyst. A blastocyst is a more advanced embryo. Many cells forming two distinct parts. Not all fertilized eggs will develop into blastocysts. This is a natural selection process. The clinic will usually call you with updates. This waiting period can be very stressful. The embryo transfer is the next step. It is much simpler than the egg retrieval. It usually happens 3 to 5 days after retrieval. The doctor and embryologist will choose the best embryo or embryos to transfer. The number of embryos to transfer is a decision you will make with your doctor. It depends on your age. It depends on embryo quality. It depends on your personal wishes. The goal is a healthy pregnancy while minimizing risk. Minimizing the risk of twins. Minimizing the risk of triplets. The transfer itself is quick and usually painless. It does not require any anesthesia. For the transfer, you will lie down as you would for a pap smear. The doctor will insert a speculum to see your cervix. The embryologist loads the selected embryo into a very thin, flexible tube called a catheter. Diagram: catheter placing an embryo inside the uterus. The doctor gently guides the catheter through the cervix and into the uterus. They use an ultrasound on your abdomen to see exactly where to place the embryo. Once in place, the embryo is gently released. The doctor slowly removes the catheter. After the procedure, you will rest for a short time before you can go home. The tiny embryo is now in place, and the next wait begins. After the embryo transfer, you enter the luteal phase. This is the period of about 2 weeks before your pregnancy test. During this time, you will need to take medication to support the uterine lining. This medication is usually progesterone. Progesterone helps make the lining of your uterus thick and receptive. It creates a welcoming environment for the embryo to implant and grow. You might take progesterone as a vaginal suppository, a gel, or an injection. It is very important to take this medication exactly as prescribed. It plays a critical role in supporting a potential early pregnancy. This 2-week wait is often called the TWW and can be the most emotionally challenging part of the entire IVF cycle. You have done everything you can, and now you must wait. It is normal to feel a mix of hope, anxiety, and impatience. You might be tempted to analyze every little twinge or symptom. Try to resist this urge, as many early pregnancy symptoms are the same as the side effects from the progesterone. Find healthy distractions. Watch movies. Read books. Go for gentle walks. Spend time with supportive friends. Lean on your coping skills and support system during this time. Be kind to yourself. About 9 to 14 days after your transfer, you will go back to the clinic for a blood test. This test is called a beta-HCG test. It measures the amount of the pregnancy hormone, HCG, in your blood. This is the most accurate way to confirm a pregnancy. Home pregnancy tests can sometimes give false results, so the blood test is the gold standard. Getting this call from the clinic with your results can be a moment of intense emotion. No matter the outcome, remember that you have been incredibly strong to get to this point. If the test is positive, congratulations. The clinic will schedule you for more blood tests and an ultrasound in a few weeks to confirm the pregnancy is progressing well. If the test is negative, it can be heartbreaking. Allow yourself to feel sad and disappointed. It is a real loss. The clinic will schedule a follow-up appointment with your doctor. In this meeting, you will review the cycle and discuss what might have happened. You can talk about what the next steps could be, whether it is another IVF cycle or exploring other options. Remember, help is available. Your clinic, counselor, and support groups